Our final part to Module 3, Part 3 of Personal Care, Pressure Injury. We'll be discussing pressure injuries during this PowerPoint and how the nurse aide can help prevent them. The objectives are to identify the conditions that can lead to formation of pressure injuries, describe the signs and symptoms of pressure injuries, discuss the special equipment that can be used in the prevention and treatment of pressure injuries. Let's start by talking about our skin. The integumentary system is composed of the skin, hair, nails, oil glands, sweat glands, subcutaneous tissue, and nerve endings. Our skin is separated into two layers. The top layer is called the epidermis and is composed of dead skin cells. The next layer is called the dermis, and this is where the hair and nail follicles, oil and sweat glands, as well as nerve endings live. The subcutaneous layer is below the dermis, and this is the area where fat, also called adipose tissue, lays. Pressure injury is the term for pressure ulcer. These injuries occur because of direct, continual pressure on an area of the body, usually over a bony area or bony prominence, as we call it, such as your heel or your tailbone. Other pressure injuries occur from shearing, we talked about that, which is rubbing or friction resulting from the skin moving one way and the bone underneath it remaining fixed, so they're moving in opposite directions. The main purpose for repositioning residents is to prevent pressure injuries. Here are some of the most common areas that may be prone to pressure injuries: the shoulder blades, elbows, knees, ankles, coccyx, ears, and the back of the head. The coccyx is the medical term for tailbone. Why are the ears included? Skin breakdown can occur if ears are not cleaned well, especially behind the ears. Another reason may be from oxygen tubing that is laying behind the ear. If it gets too tight, and it can rub on the skin. Foam can be placed on the tubing to help cushion the surface on that ear. If a resident is positioned on their side and they're laying on their ear and their ear is folded, that cuts off blood supply to that area. So we have to be very careful and make sure that their ears are resting flat. Some residents may be at high risk for developing pressure injuries. Some of the risk factors include someone who already has a current pressure injury or a history of having pressure injuries. Residents with diabetes may be at high risk as well, especially if they have neuropathy. Neuropathy is the lack of feeling in a specific area of the body. If a resident had neuropathy in their feet, they may not be able to tell that their shoes are too tight or that there is an injury. They won't feel the pain. Peripheral vascular disease causes the extremities, which are your arms and your legs, to not have circulating blood. This may cause the lack of important oxygen and nutrients to be delivered, preventing adequate tissue support is impaired. A resident who is not able to reposition themselves or is bedridden is at extreme high risk for pressure injuries. Think about it. How many times do you reposition yourself just sitting in your chair? And sometimes repositioning is as little as lifting your hand or tapping your toe. Imagine that you couldn't move and had to wait every 2 hours for even the slight movements. Do you think that some parts of your body would begin to break down? The answer is yes. Conditions leading to an injury. Continued pressure on a body part. An area that is warm, moist, and not properly cleaned could begin to have skin breakdown. Moisture could be the result of perspiration, urine, feces, or other drainage. Malnutrition and dehydration will begin to deteriorate the skin and prevent the body from properly repairing itself if there is an area that is of concern. Immobility, friction, shearing are common causes, as I mentioned before. Foreign objects can put enough pressure on the skin to cause an injury. An object can be problematic, especially for someone who cannot feel that they are sitting on something. Some common signs and symptoms of pressure injuries include a reddened area that does not go away after pressure is relieved for 30 minutes. If the resident has dark skin, the area will maybe not appear red, but more bluish in color. The area may be warm or hot to the touch, as well as being tender. Some residents may complain of pain in an area, but this may not always be present. Other residents may report that they have a burning sensation or they feel a lot of pressure on the area of concern. Please report these signs and symptoms right away to the nurse to help prevent further pressure injury. Pressure injuries are categorized in 4 stages of severity, and they progress through each stage. Stage 1 is the least severe, and that's the beginning of a pressure injury. The skin is still intact, but is red, like we just talked about, or dark, depending on the color of their skin, and that area does not go away after 30 minutes. It stays red. This stage can be reversed with early treatment, but if not treated, it can progress to the next stage, a stage 2. This involves minimal skin loss. The area can look like a blister or a shallow crater, but overall, it's still a superficial injury. It gets worse as we get up. Stage 3 involves a full thickness skin loss, meaning that the top and middle layer of skin are gone, the epidermis and dermis. Leaves the fat and muscle exposed at this point. This stage may take months to heal. To regrow skin takes a lot of time, and the body needs to be strong to build new tissue. Stage 4 is the most severe pressure injury. That is the highest stage. This area concerns, it involves the destruction of all the layers of the skin and fat, possibly muscle and tendon, can go through organ tissue, and possibly leave bone exposed. This stage may take years to heal if it's very advanced. At times, these pressure injuries do not heal, and they are chronic. All nursing staff can help pressure injuries, including the CNAs. Keep pressure off skin and bony areas, and keep pillows used for positioning. Keep residents up off of their hip or change the position if they are constantly lying or sitting. Good skin cares help prevent skin breakdown. This is very important under all the skin folds. Proper pericare, washing of the genitals and buttocks, along with applying any moisture barriers like a petroleum-based cream like Vaseline, can help prevent skin breakdown from moisture when a resident is frequently incontinent. Proper nutrition and hydration will help the body with repairing and strengthening the skin. Skin is the largest organ of the body. If you see any change in appearance on the resident's skin, notify the nurse right away. Other prevention strategies include repositioning every 2 hours for residents that are unable to position themselves. Check the care plan for what is required for each resident. Encourage residents to move more frequently if able, especially during the afternoon between activities. Lift sheets will help prevent shearing. Gait belts will prevent staff from pulling on arms and other body parts that may start to have pressure injuries. Pressure relief devices will aid in cushioning the body. Never massage a reddened or darkened area. That area has sustained an injury, and massage may cause more damage. You can massage around those areas. A light dusting of powder may help prevent moisture from accumulating in an area of the body. Check the care plan for guidance. Prevention and treatment equipment options for pressure injuries can include the following: an air mattress, Roho cushions. Those are cushions that are like air mattresses. They're either made of air, or a gel cushion, which is full of gel, and that helps redistribute weight. Pillows, protective dressings, Those are put on by the nurse and can be applied to the area that is affected to help with healing, and it gives slight padding and protection. We call those duoderm. Heel risers, that is what we see on this slide. It's a picture of a heel riser, and it goes to the foot of the bed, and it keeps the heels from being left in a state on the mattress. We can raise them up so the heel isn't left flat constantly, and we let the heels float. And also pressure relieving boots that have padding and cushioning. Sometimes a sheep skin will be used as extra padding to protect the skin and provide support instead of regular shoes. So those pressure relieving boots we have to have on whenever the resident is out of bed, and sometimes while they're in bed as well. This is the end of Module 3.